Hello there, we are here at the seventh edition of ETCFO Leadership Summit, and I have with me Ms. Sandhya Sriram, the Group CFO of Narayana Health. Thank you so much, Sandhya, for joining us here.
Thank you, Shivam. Thank you for having me here.
First, since you came out a panel which was talking about digital leadership, I want to understand from you in healthcare, in hospitals, where is AI, automation, or digitalization helping you? Is it revenue cycle? Is it cost per bed, or is it something else?
I think when we look at a digital solution, I would go back to our founder's statement with which he started the company, which is that if a solution is not affordable, it's not a solution. So for us, any tech or process or any design intervention we make with that philosophy that how do we make healthcare accessible and affordable for our patients. So that means, for example, if we implement a solution for the clinician, we are able to improve the communication, which is very important. If you see, there is published data that most of the sentinel events that occur due to communication failure, which means it affects the quality of outcomes to the patient. And therefore, if I am building a technology that enables the clinician communication effectively, then it improves the quality of care to the patient. If I'm developing a technology which reduces the wait time of the patient, and therefore it allows them to go through our hospital more quickly and therefore complete their process quickly and leave the hospital more quickly. Therefore, I'm able to run more patients through the system, bring down the cost, improve the quality, improve the patient experience. Then that's a solution. So whenever we look at any solution, the lens is it accessible? Does it make the care more accessible? Does it make the care more affordable? Is it good for our patients? And when you look at with that lens, then every other piece falls in place
But where is it currently helping you?
across the board. So, just to give some numbers, in the past 9 years or so, we've not added a single bed in our hospital. However, we have grown our revenue multifold. Our profitability has increased significantly, and it has happened because we have focused on throughput. We have focused on how do we make our processes more and more efficient through process changes and technology. They always go together. That is one example. Another example I could say is the cost of care at Narayana. If you see, these are published numbers. We are 30% lower effectively to maybe our nearest competition. However, we are able to generate similar profile of margins and cash flows similar to many of our competition. That's also because of the efficiency of care that we provide. The we do the largest number of pediatric cardiac surgeries in the country. One in six heart procedures in the country are performed by us. We do the largest number of bone marrow transplant pediatric in the country, and these are very high-end procedures and require skill, require a lot of investment, but we still are able to offer many of them at significantly subsidized rates to our patients. Every second child who gets her heart surgery in our hospital doesn't pay for her surgery, and we manage that because we've looked at patient first technology implementation, improved throughput, and improved outcomes.
Right. Healthcare runs, on a lot of sensitive patient data, and with compliances like DPDP coming in, how does that influence your decisions into, adopting technology?
So firstly, I think technology is a enabler to compliance than other way around, because the minute I have a digital footprint of data, then I know where the tap can open and where the tap can close. If I have the data on a manual footprint, which means somebody is filling up registers everywhere, then that means that I have to ensure physical custody and access. But when I have it digitally, then it allows me to manage that data more robustly. So I think digitization is an enabler for compliance. That is number one. Number two, on some of these legislations that keep coming, if you go to the core of what it does, it goes to making people feel safe with their information, with their data, with their footprint, information footprint, and the role of healthcare, if you think about it, is to make people safe physically. They are in the right hands. Make people feel safe emotionally. My data is also in the right hand. So it just goes to the core of what healthcare is supposed to do.